Hi, and welcome to Hello Live. I'm Pamela Hadfield, the co-founder of HelloMD, and I'm joined here today with Dr. Patricia Frye, our Chief Medical Officer, to talk about cannabis and depression. Well, according to the World Health Organization, depression is the leading cause of disability worldwide. It affects over 350 million people. That's a lot of people. But before we dive in, I'd like to say welcome, Dr. Frye, and maybe you can spend a little bit of time telling us, our audience, a little bit about yourself.
Well, I'm a certified cannabis clinician. I've been practicing cannabis medicine for years, and I started with HelloMD. I was the first doctor, and since that time I've been lecturing around the country to doctors groups and to hospitals and to medical groups, trying to educate the medical community on the benefits of cannabis.
Across multiple different conditions. And I always like to talk about when you first started with us as a doctor, you were interested in cannabis and willing to take that first step, but it was a bit of a process for you to get comfortable.
It was a process. It was learning the plant, understanding what it could do, and most of all, learning that the side effects were minimal and none were life-threatening, and so it gave me a little bit more room to try it with different patients. But I learned so much from the patients that were already using it that they really were an invaluable resource for me.
And over the years, through HelloMD and also through your own clinical practice, Dr. Frye has seen thousands and thousands of patients, which has led you to write a book, right? Tell us a little bit about that.
I have a book. It's the Medical Marijuana Guide, Cannabis and Your Health, and it covers the history of cannabis as a medicine. It's been with us for thousands of years, and we talk about legalization, about different clinical conditions and how it might help. We talk about how to judge which types of cannabis may work best for different conditions, how to tone the endocannabinoid system, which is our modulating system that keeps our bodies in balance. So I think it's a pretty good read.
Yeah, well, I love this book just because there are very few books out there that go into the amount of depth that you have gone into across so many different conditions. So bravo to that. And
Thank you.
Let's head straight into talking about cannabis and depression. As we both know, over the years we've seen how many people are affected by depression and how often those people actually do turn to cannabis. So the first question is, how can cannabis help individuals with depression?
Well, cannabis is known to have an antidepressant benefit. And there's been some thought that it was CBD, but actually THC seems to be most beneficial for patients for mood elevation. The THC and CBD are cannabinoids, which are compounds that are only found in the cannabis plant, but the plant is complex. And it has about 500 different compounds. About 150 of them are what we call cannabinoids, but there are other terpenes and flavonoids which are found throughout the plant world, and they all have some medicinal and aromatic benefits. And there are terpenes in the plant that also elevate mood, like limonene, which is found in citrus rind. So when these cannabinoids and terpenes work together, they seem to work through the serotonin system, neuromodulating system, and help to elevate the mood.
And so does cannabis necessarily, or THC necessarily, work for everyone in terms of depression?
No, it doesn't. And actually, I have found that THC really works better for depression than CBD. The THC should actually be kind of a low dose THC because we can run into problems. Again, THC is a biphasic compound, like many of the compounds in cannabis, that if you don't use enough, it doesn't work very well, but if you use too much, it doesn't work very well. And there are many symptoms that THC will improve at a low dose, but will make worse or cause at a high dose.
Well, that's interesting because we just had an audience question that came in that says, is it possible for cannabis to actually worsen my depression? So based on what you just said, can you go into a little bit more depth in terms of that?
Yes, heavy use of THC can actually worsen depression, and we have to be careful about that when we're recommending cannabis to patients with a history of depression. CBD can actually worsen depression, so we don't, at least I don't, recommend that patients with depression use CBD only. They need to use some type of combination of CBD and THC.
That's interesting. So in terms of the THC, less is often more.
Less is usually more with THC.
That's with most things. More is not more, or it's
Right.
just too much.
Yeah, or you just overdoing it.
Okay, so I want to remind everyone in the audience that if you have questions about cannabis and depression, please use our live chat and type in your questions, and one of our HelloMD doctors will answer. So, are you ready for a Did You Know fact?
I'm ready.
Okay, so women are more vulnerable to hormone-induced depression due to the fact that women go through many hormonal changes throughout their lifetime, including menstruation, pregnancy, childbirth, and menopause. It seems like we got the short end of the stick.
In that regard, I think we did.
All right, so I guess you already knew that.
I did.
Yeah. All right.
I'm the doctor.
You are the doctor. And it seems kind of obvious in some ways. I mean, there are a lot of different life events that happen in a woman's timeline. So anyway, let's go into the next question. So what's the research on cannabis when it comes to alleviating depression? Is there a for camp and an against camp, the pros and the cons?
Well, most of the research on depression is done in one of two camps. Either it's on CBD and depression, and those are mostly animal studies, or we're looking at cannabis use disorder and the prevalence of depression. Most of the animal studies show an antidepressant benefit or antidepressant benefit in mice with cannabidiol or CBD. That's the data, but not everything that happens in mice translates into humans.
Do they have depressed mice? How do they know this?
Well, Pamela, you're asking me I am not a researcher. They have all sorts of ways of measuring anxiety and depression. In mice, they have certain behaviors. They do maze tests and out in the open tests and all kinds of things that I really don't know exactly what the depression test is for the mice, but I'm sure these scientists have figured out when their mice are depressed or not.
Okay.
But my point is that they show that CBD is an antidepressant in mice, but we see clinically that CBD can make depression worse in humans. So my point is that we can't always translate what happens in rodents into humans. We can sometimes, but it doesn't always happen.
And I'm sure also that not everybody who has depression who takes CBD, it necessarily worsens their condition, but what you're saying is that when you look at a lot of different people, that tends to be the
right.
pattern.
Everyone has a different endocannabinoid system. They respond to cannabis differently. But when we have depressed patients, we are careful with CBD. And I know this is not just my observation. I've talked to other cannabis physicians who have observed this. The other camp in the research is looking at depression in cannabis use disorder. Most of those studies are NIDA focused, National Institute on Drug Abuse, and basically that research typically shows that when you have patients or people who are have developed a use disorder where the use of cannabis is interfering with their functioning, with their livelihood, that oftentimes there's an underlying issue with depression.
Got it. Well, that's all very fascinating, and I did not know that about CBD and depression. So another did you know fact. So depression is linked to low levels of key neurotransmitters in the brain. So most antidepressants work to replace these missing neurotransmitters. But these medications don't always work the way people need them to. As a result, more and more people are turning to cannabis.
Yes, I did know that.
And what do you think about that?
I think that's true. We use a lot of medications in the class of serotonin reuptake inhibitors. And that's why the animal data looks at cannabidiol as being an antidepressant. One, because that's one of the receptors that it actually interacts with. So you would think it would be a good antidepressant. But the antidepressants that we use, like the serotonin reuptake inhibitors, also have adverse effects. Sometimes they don't work well enough for the patient's depression, or sometimes they work, but their adverse effects like decreased libido is at the top of the list, some sleep disturbances for some patients. So not everyone responds to antidepressants that we use. Just like all medications, the FDA standard for approval is that 30% of the people who use it should have at least a 30% improvement in their symptoms over placebo. So that leaves a whole lot of people who really aren't going to benefit from that medication.
Well, that's really good information to know. So I'm going to go straight into our next question, which is, what dosing regimen should someone consider if they're interested in trying CBD or THC to help with depression?
I would say that anyone who's struggling with depression, if they're using cannabis or not, they really should be under the guidance or under the care of a mental health provider. Depression is something that we don't want to see spiral downward and lead to very serious consequences. But when I'm treating a patient with depression, and sometimes depression can be such situational, going through a divorce, you got fired from your job, you have a sick child, but then there are other times when it's an ongoing mood that can be quite disruptive and even debilitating for some patients. They absolutely need to be under the care of a mental health provider, and I will start them with a CBD-THC combination. I like CBD because it will mitigate the intoxicating effect of the THC so that they can use this during the day and still work or drive or do what they need to do. And the CBD has other benefits. It's anxiety reducing, it's relaxing, it reduces stress.
But hold on just one second, because you had just said before that CBD can actually
worsen depression.
Worsen, so
but
it's
I
the
don't,
combination.
It's the combination. I don't treat them with CBD with zero THC. That is not a good choice for someone with depression, at least in my clinical experience. So I usually start patients with a ratio of CBD to THC, somewhere around the 5-to-1. So for every 5 milligrams of CBD, there may be 1 milligram of THC. And I have them start with a low dose. We always start low and increase slowly. That's the mantra with cannabis dosing. We have to titrate because everyone responds differently. But we stay on that dose for a week. If the mood isn't improving, we'll increase it a little. If the mood isn't getting better, we'll increase it a little bit every 7 days or so. If we get to the point where we're really not getting anywhere, then I start to increase the THC. And sometimes taking that THC up to a ratio of a 1-to-1, where they're equal parts CBD and THC, can be very beneficial for patients. So it's a process. We have to try different ratios and different doses, but other monitoring by a mental health provider is important.
Well, that's fascinating information, and also I love that you are talking to our audience about seeing a mental health professional, because depression is no joke, and it's a very serious condition, and cannabis, as we know, is not a silver bullet for anything. So if you have questions about cannabis and depression, please feel free to ask them in our live chat. You can type in your question and one of our HelloMD doctors will answer. So speaking of the audience, we do have an audience question. Will cannabis interact with my depression medications?
It can. Cannabis uses a lot of the enzymes in the cytochrome P450 enzyme system that's in the liver, and that is used to metabolize almost everything. There's one enzyme in particular, the enzyme 3A4, that is used to metabolize about 65% of the prescriptions that we write. So medications, some of the SSRIs, certainly the tricyclic antidepressants, and then also some patients are on benzodiazepines. Cannabis, especially CBD, can slow down the metabolism of these medications. It's more theory than what we see, but the potential is there. So we always advise patients to space their CBD at least 2 to 3 hours apart from these types of medications.
That's great advice. Mm-hmm. Are you ready for the next Did You Know?
I am ready.
So depression magnifies pain, and therefore those with depression are more likely to feel chronic pain. Aches, cramps, and headaches are more prevalent for those who have depression.
Are you ready for a fact?
Oh, I like it when you give me them. Go on.
Not only does it magnify pain, depression can actually cause pain. Depression and anxiety can actually signal the release of pro-inflammatory mediators that increase inflammation and increase pain. So for chronic pain patients, if we don't treat their depression, if we don't treat their anxiety, we will never get up under their pain.
Well, it becomes a little bit of a chicken and the egg then too, what started first. I mean, what's interesting is this mind-body connection between the depression that may be happening in the mind and how it affects our entire system. So if somebody is depressed and feeling pain, beyond cannabis, if you have a pro-inflammation response, what other things do you suggest?
Well, that's the beauty of cannabis, and that's why it's such a marvelous little pharmacy in a flower. It will treat the depression, it will treat the anxiety, it will treat the pain, it will treat the neuropathy, it will decrease the inflammation. So it's like taking an antidepressant, an anti-inflammatory, an anxiolytic like a benzodiazepine, and a muscle relaxant all in one.
Well, that kind of leads into the next question, which is, what are a few lifestyle changes people can adopt to help them manage their depression?
Well, this is important because there are a lot of things that can help. The theory now is that part of the underlying pathophysiology, or what causes things like depression and anxiety, we're back to neuroinflammation. Inflammation is the root cause of a lot of issues. And so patients can do things to decrease the inflammation. They can go back to healthy eating, looking at whole foods instead of processed foods. So junk food, processed food, fast food, these all fuel inflammation. Going to animal protein. Animal protein is fine, but those animals need to be from small farmed, grass-fed environments where they're not filled with stress hormones and other omega-6s, which are pro-inflammatory. The grains that a lot of the animals, including the chickens, are fed are chock full of omega-6. And while we need some omega-6 to make our endocannabinoids and to make a lot of things in our bodies, our American diet has way too much omega-6. The ratio of omega-6 to omega-3 should be about 4 to 1. It's actually about 16 to 1 in the standard American diet.
Wow.
And so speaking of omega-3, besides lowering the omega-6 by the foods you eat, taking an omega-3 supplement may help. It could be from fish, and if you're a vegan, it could be from algae or from hemp. But trying to work on that balance of omega-6 to omega-3 will actually help neuroinflammation and help depression. Exercise is key. And while vigorous exercise is not necessarily the answer to weight loss, it can be the answer to, or part of the answer to, treating depression and anxiety. It can make a tremendous difference. Sleep is important. Patients need to get 7 to 8 hours of sleep. Here again, we have our little medicine in this flower, cannabis, CBD at high doses, THC at low doses, can be very beneficial for sleep. There are mind-body techniques that can help patients, like cognitive behavioral therapy, biofeedback. There are a number of energy practices that really do help people feel better.
All of that is fascinating, especially I love the omega-3s and the omega-6. I had no idea.
Yeah.
Well, another did you know.
Okay.
So the increased stress that comes with a newborn can lead to postpartum depression, otherwise known as PPD, and affects approximately 10 to 20% of new mothers due to the influx of hormonal and lifestyle changes.
That's
so
true.
when this happens, I mean, it's kind of an interesting fact, but as you know, we don't actually recommend that new mothers smoke cannabis or ingest cannabis, especially if they're breastfeeding. What are your thoughts on that?
Well, those are my thoughts. That the
reading
postpartum
your
depression
mind.
is hormonal. The cannabis really isn't going to fix the hormonal imbalance. And I would reserve cannabis therapy for very few and very severe cases where these women are not improving with therapies that we know to be safe for newborns or for infants if they're breastfeeding. If they're not breastfeeding, then I would treat them the way I would any other patient with depression with a CBD THC combination. But I do look at, again, risk versus benefit or benefit versus risk when it comes to breastfeeding. I would rather have a mother home and feeling better and using small amounts of cannabinoids as opposed to being sick, to being so depressed that she could be, let's say, a danger to herself or her family. So it's about judging each individual case, but blanketly I don't recommend using cannabis for breastfeeding moms because we just don't know the full impact of those extra cannabinoids on that newborn. They're important for neurodevelopment, but we don't know if adding more makes a difference in the long run.
That's great advice. I know that after my first child, I actually suffered severe postpartum depression, and I chose not to go on to the medication, and I really, really regret that because I was at that place where it was so severe, and I think that, you know, sometimes we're so concerned about the baby, but we have to be as concerned about the mother's mental health.
Yes, right.
And luckily everything went right. Okay, so the last question. What is the best mode of delivery with cannabis for depression?
Well, I prefer oral mucosal or sublingual absorption with some intestinal absorption. The reason being is that inhalation, while it may be effective momentarily, it's only going to be active in the body for about 2 to 3 hours. And so you want something that's going to last longer. Edibles where you chew up and swallow, they're too difficult to titrate the dose. The absorption is very unpredictable, and while they last a long time, it's really difficult to medicate with edibles. But with using a tincture, an oil-based tincture, or even an alcohol-based tincture, you can either put the oil-based tincture directly under the tongue. Some of the medicine is absorbed into the bloodstream directly. The rest is absorbed through the intestines. Or with an alcohol-based tincture, it can be put in a small amount of water or a little bit of tea, and you can swish it and then swallow. You'll get some absorption within 45 minutes or so, but the rest will go through the intestines and extend what we call the duration of action to 5 to 8 hours. So for something like a mood issue like depression, it's best to dose with something that will last most of the day, and patients could dose twice a day. Some do fine with just once a day, and then maybe a little THC or a larger dose of CBD at bedtime to help with sleep.
Well, thank you for that in-depth answer. And I also want to thank you for answering all of these questions today. I learned so much from you, and I'm hoping that everyone in the audience learned something today too. So this is a wrap for today. Thank you so much for watching, and continue to tune in for our Ask a Doctor series.